Hi, it's Andy and Alan again on a Sunday morning, and we're going to talk about a medical topic. And this time, Alan, I'm reading a book called The Body Keeps Score by Vanderbach. I don't know who Vanderbach is, and I'm only a partially way through this book, but it's a lot about post-traumatic stress disorder, which is something we see all the time. And it's something interestingly that even the VA, when this guy was starting his career in the 80s, did not recognize as a condition. And it's only now become the main condition the VA treats. But he talks a lot about the advent of psychiatric drugs, of mental health drugs, much of which occurred during his training. And I just wanted to, and he talks about it in a very positive light. Like they really changed the way we look at things. And he said, by the 70s, he says the medical community had completely accepted what's called a physiologic view of psychiatry, that everything is chemical, and that's all we need to do is treat chemicals. And he also talks about how the drug companies were funding all the research in his lab. At that point, he didn't think twice about it, but they were clearly steering it. So I wanted to read a couple quotes from this book, and then we'll jump from there. Excuse me if I take off my glasses because I'm old. Um, Over the past 3 decades, psychiatric medicines have become a mainstay in our culture with dubious consequences. Consider the case of antidepressants. If they were indeed as effective as we have been led to believe, depression should have been now a minor issue in our society. Instead, even as antidepressant use continues to increase, it has not made a dent in hospital admissions for depression. The number of people treated for depression has tripled over the past 2 decades, and 1 in 10 Americans now take antidepressants. And one more quote. Because drugs have become so profitable, major medical journals rarely publish studies on non-drug treatments of mental health problems. Practitioners who explore treatments are typically marginalized as alternative. Studies of non-drug treatments are rarely funded, unless they are involve so-called manualized protocols where patients go through a narrowly prescribed sequence that allows little fine-tuning to individual patient needs. Mainstream medicine is firmly committed to a better life through chemistry, and the fact that we can actually change our own physiology and inner equilibrium by means other than drugs is rarely considered. So what do you think?
So Andy, I think my professional life is be very embedded in mental health. I start every morning at 5 a.m. on our inpatient psych ward or our psych ER. We have two 28 to 30 bed units at the hospital I work in, and a very large what's called CPAP, which is a emergency room and holding kind of unit. Um, and the incidence of mental health is really high. A lot of those people are homeless, not connected to care very well. But yeah, I agree with this, and I think we've changed the world, especially in the people that are not like severely psychotic. We know there's a spectrum of mental health disease from, mild dysthymia means like everybody has a sad day and they have ups and downs to people who are truly like criminally insane and psychotic that, need more intensive therapy. But I agree with everything you said. I do think that, the advent of SSRIs, if people don't know what SSRIs are, serotonin reuptake inhibitors, before that, we had some bad drugs, as far as efficacy and side effects, tricyclic antidepressants and MAO inhibitors. So there was an advance, but you're right. Most of the patients I see on these meds are not any better. And some of the bigger things that scare me more is, I'm finding more of my patients are just being put on antipsychotic drugs, which are, major tranquilizers. We should talk about them because they have just exploded in its use, I think, even more than antidepressants. Like you don't see antidepressants advertised on TV very much anymore, but you see lots of antipsychotic drugs advertised, which is kind of strange. And yeah, like everything else in medicine, the pharmaceutical industry is taken over. And, there's a drug for that. Psychiatrists, don't spend more than 10 minutes. They talk to a patient for a couple of minutes and they prescribe a drug. And like you said, like non-pharmacological therapies have become, exotic. No, nobody gets psychotherapy anymore. Not that we know if it was effective or not. There are some proven therapies like, cognitive behavioral therapy. And, I can't find a provider to do it. Like, there's some evidence in the literature and it's non-pharmacologic. So, you kind of stuck. It's, being back on the hamster wheel of, going nowhere and improving nothing. And again, we're the most medicated country in the world, but, we don't have the good outcomes to show for it in decreased hospitalizations and better mental health. In fact, we have high suicide rates and high depression rates and high hospitalization rates.
And to your point in this book, because you take care of a more impoverished population, he says that Medicaid spends more on antipsychotics than on any other class of drugs. And he goes on to talk about these antipsychotics, starting with a drug called Thorazine, which came out when he was training, that they actually, when used in, like you say, very psychotic people, helped. And they clearly helped, this massive psychosis. But then he said now they've created diseases and conditions whereby everyone is on an antidepressant and antipsychotic. So kids who are unruly, which I was to some extent because I didn't listen to authority, which might shock you, Alan, as a kid, but kids like that are given antipsychotics. Kids who are hyperactive might be given either ADD drugs and or antipsychotics. They're all put on antidepressants. Kids are loaded with antipsychotics. And the book on Johnson and Johnson, which talked about Risperdal, talked about how kids suffer from these drugs. It gave a lot of boys breasts. It made them obese. It gave them diabetes. It affected their mental status. They couldn't learn anymore. They were like robots walking around. And the use of these drugs to control behavior and to control made up symptoms. I'm sorry, made up diagnoses. So, like you say, depression is now so broadly defined. And the manual we use that lists psychiatric illness, which has grown dramatically over the years. What is it, fifth or sixth version? Um,
And it's about this thick,
about
it's
that thick. And they've done studies recently that everyone who writes this is strongly tied to the pharmaceutical industry. The whole goal of this manual is to create illnesses you could treat with medicine.
exactly.
And bipolar disease is a great example. All these kids are coming in, young people, I got bipolar disease. I know of bipolar disease. They do not have bipolar disease. They just get agitated sometimes and sad sometimes, which is called the human condition. Now we're treating basically being alive with medicine because we're not allowed to have any symptoms that vary from perfect.
No, you said it perfectly. There's a drug for everything, and there's a name for a new disease that we want to create for everything. And the DSM is actually probably one, I didn't think of it that way, the best example, because, every time the next version comes out, it's thicker because they've invented more diagnoses. And when you really think about ADD and ADHD, I'm not saying there's not extreme versions. There are. We know there are more significant ones that are associated possibly with psychoses and depression and things like that. But like every kid is being put on a drug right now, because they don't do well in school or they don't, they act up a little bit or they don't sit for a while. So, therefore, we have to give them a diagnosis. And if you want to include, autism and the autistic spectrum disorders, which I believe is in the DSM, they've created like 500 subcategories of that as well. And some are saying, it's, not vaccines or Tylenol after all, that, we're just
Mhm.
making more people diagnosed. Like we're giving people the diagnosis and people who were extreme in autism back in our day were probably more labeled like mentally retarded and things like that and intellectual disabilities and the people now are labeled Asperger's and spectrum and I can't go a day I'm not walking down the hall and one of my colleagues doesn't say like, "Oh, that doctor's got Asperger's," and I said, yeah, I guess all doctors have Asperger's. I guess we should all be drugged.
We used to call them engineers. what they call Asperger's, we just called engineers. But people who are much more introspective, and they don't like dealing with people as much. That's just it's what some people are. I mean, it's just in fact, many of the geniuses in the world fall into that category. But look at dementia, right? At the time Medicare and Medicaid were created in 1965, dementia and Alzheimer's were not diagnoses. People would call them getting old or senility of aging. There are names for them. Now we've divided them into very specific categories. We have tests, more and more tests for them. Now we're saying we have to treat amyloid, which is a protein in the brain, with drugs, and more tests for amyloid. And let's get as specific as possible in diagnosing these, creating a whole field. I had a patient recently asked, a son of a patient saying, "Can you find me a dementia specialist in this area?" I said, "Yeah, I am." They said, "What's your criteria?" I said, "I treat a lot of people with dementia." I said, it's called experience and reading. That's I don't know what you're looking for,
And
but
that's your population. And
yeah.
it's funny, like you bring it up, it just now hit me. Like, yeah, growing up, there were two diseases. We called it pre-senile dementia if they were younger, and if they were older, it was senile dementia. And that was
Right.
it.
It's very simple. And you didn't treat it with drugs. And
Right.
the idea of treating these with drugs, which don't work, and it's a multi-billion dollar industry, and created an entire group of doctors whose job it is to deceive patients and families into thinking there's some medical treatment for this. And all it's done is making people sicker. But you're right, with the autism, it's the same way. I mean, I've said this from the beginning when Kennedy was talking about the increase in autism being correlating with vaccines, and now Tylenol, right? I'm taking Tylenol for my knee, and I keep saying, "God, I feel very autistic today. I maybe I
Mhm.
took too much Tylenol." But the idea that it correlates doesn't mean it's cause and effect. I mean, you could look at other things that have happened in our world, such as plastics and metals in our food and pesticides. But you could also say, like you said, we're just diagnosing more of it. I mean, it's no different than diabetes. Yeah, there might be some more diabetes. But we are definitely eating poorly and relying on doctors instead of relying on ourselves, which is what this guy says in the psychiatric book. We've stopped trying to help ourselves or deal with methods of doing this through diet and culture and biofeedback, and we're just relying on drugs, and doctors are pushing drugs. Diabetes is the same way. We expanded the definition of diabetes several times now. We added a diagnosis called prediabetes, and now 75% of adults have one of those too. And they say, "My God, we have a diabetes revolution." And by the way, that revolution has occurred, that epidemic, I mean, has occurred as we're adding more diabetic drugs. My friend and I were talking about yesterday how there are about 35 to 40 diabetic drugs out there on the market, most of which have dubious benefit, many of which are proved harmful and still used. And we have diabetes drugs that lower sugar and increase heart attack risk. I mean, who's going on a drug like that? But how many billions of dollars of people are going on that?
Well, you gotta get the numbers down. So,
Yeah,
we have better report cards and, people feel better that their number is good,
right.
even though
Even if
they're,
they're going to die
yeah.
sooner, it almost doesn't matter. It's this reliance and the weight loss stuff. It's all this reliance on drugs instead of helping ourselves. And the way to do that, the way the medical communities done that, with the complete lack of pushback from doctors. Doctors totally accept this, is to invent more diagnoses,
Yeah.
to call every condition. I wrote in my book, Curing Medicare, I said, because there was a guy named Martin Hadler who wrote a book called Redefining Aging. And he said, "Eh, being elderly is now a disease." He
Yep.
said it's treatable with medicines and tests. And so I went through the ICD-9 at the time, and wrinkles is a diagnosis. And there are treatments for everything you have as you get older is now being diagnosed as a disease instead of normal aging. So
Yeah. And I and I
we're all
love so
sick.
I love some of the aging diagnoses that people have invented so you could like increase the billing codes that you have more. Like, if someone has a little old lady with bruising on the skin, if you make it senile purpura, you get more money and stuff like that.
Right.
And people do it. And every day someone's coming to me, oh, you got to use the code if they can't take care of themselves. Functional quadriplegia, it gets you a much higher level. Like, whoever put that before? It was like, okay, that's half of my elderly people.
Exactly.
It's if I could, you could double the income on that.
But it is you invent. Yeah, I mean, and it's very subtle, right? People don't realize this is happening. I can't tell you with like bipolar how many of my patients say, "Yeah, all my kids are bipolar." I'm like, "Really? They're going through school, they're doing okay, but they have some mood swings, so now they
Yeah.
have this diagnosis."
And then if you have a good code, like the government stops you from using it, like in hospice and palliative care. We used to put, all of our patients down. The closest thing to being olding and dying was either frailty or functional decline.
Right.
And they don't let you use it. Like it totally describes what it is. You don't need all these fancier names. But I have to tell you, Andy, the part of this that's killing me the most is what we're doing to the kids in this country. And
Hmm.
you have to say RFK is right there. We're creating a generation of chronic complex illness in children. And one of those big ones is mental illness. And so many of these kids are on drugs. And we're seeing escalating rates of suicide and homicide and diabetes and obesity and hypertension from the drugs that we're creating. So, we're doing it to the kids and essentially by the time they're an adult, they're totally incapacitated to function as a normal human being.
And I've seen that even in my practice. Because I see a lot of my patients' grandkids, and this is the big problem is I'm shocked. Not only how many doctors they see at their young age, but how many medicines and tests they're going through. And the other problem I'm seeing in this generation of young people is they've come now to accept the validity of this model that everything they have, they run to the doctor more than anyone I've ever seen in my life for everything. And they just one little thing goes out of whack and they want some medicine and they want the doctor and it's really scary for the future because a lot of my older people are much more reasonable than that. They have some skepticism about the system. They said, "Well, my mother said if you eat well, then you're in good shape." And I'm like, "Yeah, your mom was right." I said, "That's why you're 95 right now." But their kids not and grandkids not that way. They're even the kids who deal with the older people are like, mom sugars. I'm watching the mom sugars and I'm watching mom. I saw her take a step a little bit off. Should we get a neurologist for this? It's like, really? I said she's doing really well. I said I don't get all this micromanaging, but the micromanaging is created by our medical system that wants you to think everyone's sick and they will have a diagnosis or 12 for you and each one requires a specialist, a test, a medicine, and that certainly with psychiatry we've seen this with chronic pain we've seen this. You go up and down the line, diabetes, heart disease, no one's getting better.
Yeah.
Everyone's medicated.
And we just want to create another drug so they could make more money. The big recent example of it, it just kills me. So for the folks here, there's a drug called ketamine. So ketamine, I use in end-of-life care, hospice and palliative care as a pain medicine. It's considered like a non non-straight opioid drug that has a lot of psychometric types of effects, including effects like LSD and acid if it doesn't work right. And someone comes up with an article that, if you give someone a dose of ketamine for pain at end of life, and 2 days later they wake up and they're happy and they're not depressed anymore, and you've now cured like depression and end of life. So, the pharmaceutical companies get on the bandwagon and they take this drug, which is essentially free, and they repurpose it and repackage it into a nasal spray, which is literally this astronomical price to spray a spray of a generic drug up your nose, which is now supposedly, the next drug to cure depression. So again, one study, pharmaceutical company, and now I don't know if you have them, down in your neck of the woods, Andy, but New York City is loaded with ketamine infusion centers
Wow.
where you could go to an infusion center and say, I'm a little down and I'm a little depressed and I have chronic pain, and they will give you an IV infusion of ketamine for like $1,500.
Mm.
And mind you, the ketamine is probably like $10 for the drug. So we just find a way to bump up the costs, up the hype and hurt people more because it's no one evidence that it's a safe drug, including the fact that it's now opened the door that everybody is studying now, the use of LSD to treat everything
Yeah.
because, it made people happy in the 60s. So let's see how it could make people happy now.
They were complaining happy though. They weren't really happy. They were just always bitter about something. In the 60s. But yeah, as a final thing, I mean, in the psychiatric world, and we're not addressing the idea of why are so many people unhappy. You know, what's so screwed up about our society that we're making people unhappy? And I'll posit too that when you create illness and diagnoses, you're creating fear. And I think people are medically afraid now, much more than they ever were before. And they're always thinking they got the next disease because this is what the consumer culture has created. This is what their doctors are telling them. This is what the media is telling them. And they're miserable because of it. They're just running scared at this point.
Again, the medical industrial complex, as we know, has become the biggest lobby group. They're getting the word out. They're advertising all over TV. Every news program now has, a medical consultant with their, opinions of how things should be, whether it's about, the COVID vaccine or RFK or anything else. And people are just talking about being sick. And, when do you see the talks about healthy eating and exercise and, taking care of your body so you don't get all this crap? But, it's almost like you feel like people want to have this crap. Like people want to take 14 drugs, hey, look at my cabinet. I'm on 14 drugs. How many are you taking? And, how many ologists do you have? And, do you have a therapist and a psychiatrist? We have 20 providers for everyone. It's good for the medical industrial complex. And unfortunately, primary care gets let out of this again. And if we had a strong primary care-based healthcare system where primary care docs use less of these drugs and try and make people healthy and prevent chronic complex illness, we'd be a better place.
We'd be a better place and people would be a lot happier. And I really think this is a big part of happiness is trying to get away from this whole medical model and thinking you're sick all the time. Don't think you're sick all the time. You're just take care of yourself and you're going to be fine.
Wait,
So
did you see this on my hand, Andy? It could be something. Maybe a dermatologist will take it off for
exactly.
$2,000.
Exactly. And dig a hole in you, then you can see the plastic surgeon after that. So it's all good. Okay, Alan, have a great weekend.
You too, Andy. You take care. This was interesting to say the least.
Yes.